Drug for bipolar disorder. Introduction to bipolar disorder. Definition and overview. Bipolar disorder, previously known as manic depressive illness, is a mental health condition characterized by significant mood swings, including emotional highs, mania or hypomania, and lows, depression. These mood swings can affect sleep, energy levels, behavior, judgment, and the ability to think clearly. Bipolar disorder is a lifelong condition, but with appropriate treatment, individuals can manage their symptoms and lead productive lives. Types of bipolar disorder. There are several types of bipolar disorder, each characterized by the pattern and severity of mood episodes. 1. Bipolar I disorder, defined by manic episodes that last at least 7 days or by manic symptoms that are so severe that immediate hospital care is needed. Depressive episodes occur as well, typically lasting at least 2 weeks. Mixed episodes, having both manic and depressive symptoms at the same time, are also possible. 2. Bipolar II disorder, defined by a pattern of depressive episodes and hypomanic episodes, but not the full-blown manic episodes that are typical of bipolar I disorder. 3. Cyclothymic disorder, cyclothymia, periods of hypomanic symptoms as well as periods of depressive symptoms lasting for at least 2 years, 1 year in children and adolescents. However, the symptoms do not meet the diagnostic requirements for a hypomanic episode and a depressive episode. For other specified and unspecified bipolar and related disorders, bipolar disorder symptoms that do not match the 3 categories listed above. Symptoms and diagnosis. The symptoms of bipolar disorder can vary significantly from person to person and can change over time. Common symptoms of manic and depressive episodes include manic/hypomanic episode symptoms: increased energy, activity, and restlessness. Excessively high, overly euphoric mood. Extreme irritability. Racing thoughts and talking very fast. Distractibility. Decreased need for sleep. Unrealistic beliefs in one's abilities and powers. Poor judgment and decision-making. Spending sprees, increased sexual drive, substance abuse. Depressive episode symptoms: persistent sad, anxious, or empty mood. Feelings of hopelessness or pessimism. Feelings of guilt, worthlessness, or helplessness. Loss of interest or pleasure in activities once enjoyed. Decreased energy or fatigue. Difficulty concentrating, remembering, making decisions. Restlessness or irritability. Changes in sleep patterns. Appetite and/or weight changes. Thoughts of death or suicide. Diagnosing bipolar disorder involves a thorough evaluation by a mental health professional, including a physical examination, an interview, and a review of the patient's medical history. There are no specific blood tests or brain scans to diagnose bipolar disorder, but these tests can help rule out other conditions that might cause similar symptoms. Impact on daily life. Bipolar disorder can have a profound impact on all aspects of an individual's life, including relationships, work, and social functioning. Manic episodes can lead to risky behavior and poor decision-making, while depressive episodes can cause difficulties in maintaining daily responsibilities and relationships. Effective management of bipolar disorder often requires a combination of medication, therapy, lifestyle changes, and support from loved ones. Treatment overview. Importance of treatment. Treating bipolar disorder is crucial for several reasons. Without appropriate treatment, individuals with bipolar disorder are at a higher risk of severe mood swings that can disrupt their lives, relationships, and work. Untreated bipolar disorder can also lead to an increased risk of suicide. Effective treatment helps stabilize mood swings, improve quality of life, and prevent relapses. Non-pharmacological treatments. In addition to medications, several non-pharmacological treatments are essential in managing bipolar disorder. 1. Psychotherapy. Cognitive behavioral therapy, CBT, helps patients identify and change negative thought patterns and behaviors. Interpersonal and social rhythm therapy, IPSRT, focuses on stabilizing daily rhythms, such as sleep and eating patterns, to improve mood stability. Family-focused therapy involves family members in treatment to improve communication and support. 2. Lifestyle changes. Regular exercise helps improve mood and overall health. Healthy diet, eating a balanced diet can affect mood and energy levels. Adequate sleep, maintaining a regular sleep schedule is crucial for mood stability. Stress management, techniques such as mindfulness, meditation, and relaxation exercises can help manage stress and prevent mood episodes. Overview of pharmacological treatments. Pharmacological treatments are often the cornerstone of managing bipolar disorder. The primary goal of medication is to stabilize mood and prevent the occurrence of manic and depressive episodes. The main classes of drugs used include mood stabilizers, antipsychotics, and sometimes antidepressants. Types of drugs used for bipolar disorder. Mood stabilizers. Mood stabilizers are the foundation of pharmacological treatment for bipolar disorder. They help control mood swings and prevent both manic and depressive episodes. Lithium. Anticonvulsants, e.g., valproate, lamotrigine, carbamazepine. Antipsychotics. Antipsychotics are used to treat symptoms of mania and can also help with depressive symptoms in some cases. They are often used in combination with mood stabilizers. Atypical antipsychotics, e.g., olanzapine, quetiapine, risperidone. Typical antipsychotics. Antidepressants. While antidepressants can be used to treat depressive episodes, they are used with caution in bipolar disorder because they can sometimes trigger manic episodes. They are often prescribed alongside mood stabilizers. SSRIs, selective serotonin reuptake inhibitors. SNRIs, serotonin norepinephrine reuptake inhibitors. Other medications. Other medications that might be used in the treatment of bipolar disorder include benzodiazepines, used short-term for anxiety and insomnia. Calcium channel blockers, sometimes used as mood stabilizers when other medications are not effective or not tolerated. Now let's dive deeper into each category of medications, starting with mood stabilizers. Mood stabilizers. Lithium. Lithium is one of the oldest and most well-known mood stabilizers used to treat bipolar disorder. It is particularly effective for reducing the frequency and severity of manic episodes and can also help prevent depressive episodes. History and discovery. Lithium's mood-stabilizing properties were first discovered in the mid-20th century. Its use in psychiatry was pioneered by Australian psychiatrist John Cade in 1949, who found that lithium had calming effects on patients with mania. Mechanism of action. The exact mechanism of action of lithium is not fully understood. However, it is believed to work by affecting various neurotransmitters in the brain, including serotonin and norepinephrine. Lithium also influences the function of certain enzymes and cellular signaling pathways involved in mood regulation. Efficacy and benefits. Efficacy. Lithium is highly effective in reducing the risk of manic and depressive episodes in individuals with bipolar disorder. It is considered the gold standard for mood stabilization. Benefits. In addition to stabilizing mood, lithium can reduce the risk of suicide in patients with bipolar disorder. Side effects and risks. While lithium is effective, it can have significant side effects, including tremors, weight gain, increased thirst and urination, gastrointestinal issues, nausea, diarrhea, thyroid and kidney problems. Due to these potential side effects, regular monitoring is essential for patients on lithium therapy. Monitoring and dosage. Patients taking lithium need regular blood tests to monitor lithium levels, kidney function, and thyroid function. The therapeutic range for lithium is narrow, meaning that the difference between an effective dose and a toxic dose is small. Therefore, precise dosing and close monitoring are crucial. Anticonvulsants. Anticonvulsants, originally developed to treat epilepsy, are also effective mood stabilizers for bipolar disorder. Some of the most commonly used anticonvulsants include valproate, valproic acid, D-valproic sodium, lamotrigine, carbamazepine, valproate. Valproate is widely used to treat both manic and mixed episodes of bipolar disorder. Mechanism of action. Valproate works by increasing levels of gamma-aminobutyric acid, GABA, an inhibitory neurotransmitter that helps calm neural activity. Efficacy and benefits. Efficacy: valproate is effective in treating acute manic episodes and is also used for long-term maintenance therapy. Benefits: it is particularly useful for patients who do not respond well to lithium. Side effects and risks. Weight gain, hair loss, tremors, gastrointestinal issues, liver and pancreatic problems. Regular monitoring of liver function and blood counts is required for patients on valproate. Lamotrigine. Lamotrigine is primarily used for preventing depressive episodes in bipolar disorder. Mechanism of action. Lamotrigine works by stabilizing neuronal membranes and inhibiting the release of glutamate, an excitatory neurotransmitter. Efficacy and benefits. Efficacy: lamotrigine is effective in preventing depressive episodes and has fewer side effects compared to other mood stabilizers. Benefits: it is well tolerated and has a low risk of inducing mania. Side effects and risks. Rash, including a rare but serious condition called Stevens-Johnson syndrome. Headache, nausea, insomnia. Carbamazepine. Carbamazepine is used to treat acute mania and as a maintenance therapy for bipolar disorder. Mechanism of action. Carbamazepine works by reducing synaptic transmission and stabilizing neuronal membranes. Efficacy and benefits. Efficacy: effective in treating manic and mixed episodes. Benefits: useful for patients who do not respond to other mood stabilizers. Side effects and risks. Drowsiness, dizziness, double vision. Blood disorders, e.g., agranulocytosis, aplastic anemia. Liver problems. Regular monitoring of blood counts and liver function is required. This concludes the section on mood stabilizers. Next, let's explore antipsychotics. Antipsychotics. Antipsychotics are an important component of treatment for bipolar disorder, particularly for managing manic episodes and, in some cases, depressive episodes. They are classified into two main categories: atypical antipsychotics and typical antipsychotics. Atypical antipsychotics. Atypical antipsychotics, also known as second-generation antipsychotics, are commonly used in the treatment of bipolar disorder due to their effectiveness and relatively better side effect profile compared to typical antipsychotics. Overview and differences from typical antipsychotics. Atypical antipsychotics differ from typical antipsychotics in their mechanisms of action and side effect profiles. They target both dopamine and serotonin receptors, which helps in managing a broader range of symptoms with fewer extrapyramidal side effects, e.g., tremors, rigidity. Common atypical antipsychotics used: olanzapine, quetiapine, risperidone, aripiprazole, ziprasidone. Olanzapine. Olanzapine is effective for both manic and mixed episodes and is often used in combination with other medications. Mechanism of action: olanzapine blocks dopamine and serotonin receptors in the brain. Efficacy: effective in reducing manic symptoms and preventing relapse. Side effects: weight gain, metabolic syndrome, sedation. Quetiapine. Quetiapine is used to treat manic, mixed, and depressive episodes in bipolar disorder. Mechanism of action: quetiapine blocks multiple neurotransmitter receptors, including dopamine and serotonin receptors. Efficacy: effective in treating a broad range of bipolar symptoms, including depression. Side effects: sedation, weight gain, dizziness, metabolic changes. Risperidone. Risperidone is used for treating manic episodes and is effective in both acute and maintenance therapy. Mechanism of action: risperidone blocks dopamine and serotonin receptors. Efficacy: effective in reducing manic symptoms. Side effects: extrapyramidal symptoms, at higher doses, weight gain, increased prolactin levels. Aripiprazole. Aripiprazole is unique among antipsychotics because it acts as a partial agonist at dopamine receptors. Mechanism of action: aripiprazole modulates dopamine and serotonin activity. Efficacy: effective in treating manic and mixed episodes. Side effects: akathisia, restlessness, nausea, insomnia. Ziprasidone. Ziprasidone is used to treat manic and mixed episodes. Mechanism of action: ziprasidone blocks dopamine and serotonin receptors. Efficacy: effective in managing manic symptoms. Side effects: QT prolongation, a type of heart rhythm disturbance, sedation, dizziness. Long-term use and metabolic effects. While atypical antipsychotics are effective, long-term use can lead to metabolic side effects such as weight gain, diabetes, and dyslipidemia. Regular monitoring of weight, blood sugar, and lipid levels is essential for patients on these medications. Typical antipsychotics. Typical antipsychotics, also known as first-generation antipsychotics, are less commonly used in bipolar disorder due to their higher risk of extrapyramidal side effects. Overview. Typical antipsychotics primarily target dopamine receptors and are effective in reducing manic symptoms. Use in bipolar disorder. Examples: haloperidol, chlorpromazine. Efficacy: effective in treating acute mania. Side effects: extrapyramidal symptoms, tardive dyskinesia, sedation. With the sections on mood stabilizers and antipsychotics covered, let's proceed to antidepressants. Antidepressants. Antidepressants can be used to treat depressive episodes in bipolar disorder, but their use is controversial due to the risk of inducing mania or rapid cycling. Role in treating bipolar disorder. Antidepressants are often prescribed alongside mood stabilizers to mitigate the risk of triggering manic episodes. They are used cautiously and typically for short-term treatment of acute depressive episodes. Risks of inducing mania. One of the significant risks of using antidepressants in bipolar disorder is the potential to induce a manic or hypomanic episode. This risk is particularly high in patients with a history of rapid cycling or mixed episodes. Types of antidepressants used. SSRIs, selective serotonin reuptake inhibitors. SNRIs, serotonin norepinephrine reuptake inhibitors. SSRIs. SSRIs are commonly prescribed for depression and are considered safer than older antidepressants. Examples: fluoxetine, sertraline, citalopram. Mechanism of action: SSRIs increase serotonin levels in the brain by inhibiting its reuptake. Efficacy: effective in treating depressive symptoms. Side effects: nausea, insomnia, sexual dysfunction. SNRIs. SNRIs target both serotonin and norepinephrine reuptake, providing a broader spectrum of action. Examples: venlafaxine, duloxetine. Mechanism of action: SNRIs increase levels of serotonin and norepinephrine in the brain. Efficacy: effective in treating depression and anxiety. Side effects: nausea, increased blood pressure, insomnia. Combination therapy with mood stabilizers. To minimize the risk of inducing mania, antidepressants are often used in combination with mood stabilizers. This approach helps stabilize mood while addressing depressive symptoms. Next, we will discuss combination therapy. Combination therapy. Combination therapy involves using multiple medications to manage the complex symptoms of bipolar disorder effectively. Importance of personalized treatment plans. Each patient with bipolar disorder has a unique set of symptoms and treatment needs. Personalized treatment plans, often involving a combination of medications, are crucial for achieving the best outcomes. Strategies for combining medications. Combining medications requires careful consideration of the benefits and potential interactions between drugs. Common strategies include mood stabilizer plus antipsychotic, often used to manage acute mania and for long-term maintenance. Mood stabilizer plus antidepressant, used to treat depressive episodes while minimizing the risk of mania. Antipsychotic plus antidepressant, sometimes used for patients who do not respond to mood stabilizers alone. Common combinations and their benefits. Lithium plus valproate, effective for patients with severe manic episodes. Lithium plus lamotrigine, useful for preventing both manic and depressive episodes. Quetiapine plus SSRIs, effective for treating depressive episodes in bipolar disorder. Risks and monitoring. Combining medications can increase the risk of side effects and drug interactions. Regular monitoring and adjustments by a healthcare provider are essential to ensure the safety and effectiveness of combination therapy. Now, let's look at emerging treatments and research. Emerging treatments and research. The field of bipolar disorder treatment is continuously evolving, with ongoing research aimed at discovering new medications and improving existing therapies. New drug developments. Several new drugs and treatment approaches are being explored, including ketamine, investigated for its rapid antidepressant effects. Lurasidone, an atypical antipsychotic showing promise in treating bipolar depression. Cariprazine, an atypical antipsychotic with partial agonist activity at dopamine receptors. Advances in understanding bipolar disorder. Recent research has provided new insights into the biological mechanisms underlying bipolar disorder, including genetic factors, studies identifying specific genes associated with bipolar disorder. Neuroimaging, advanced imaging techniques revealing structural and functional brain abnormalities in bipolar patients. Biomarkers, efforts to identify biological markers that can predict treatment response and disease progression. Future directions in pharmacological treatment. Future research is likely to focus on personalized medicine, tailoring treatments based on genetic and biological markers. Novel therapies, developing drugs targeting new pathways involved in mood regulation. Improving existing treatments, enhancing the efficacy and reducing the side effects of current medications. Next, we'll discuss patient management and monitoring. Patient management and monitoring. Effective management of bipolar disorder involves regular monitoring and a comprehensive treatment plan. Importance of regular monitoring. Regular monitoring helps ensure that medications are effective and that any side effects are promptly addressed. It also allows healthcare providers to adjust treatment plans as needed. Blood tests and other diagnostic tools. Patients on mood stabilizers and antipsychotics often require regular blood tests to monitor lithium levels, ensuring therapeutic levels and preventing toxicity. Liver function, monitoring for potential liver damage from medications like valproate and carbamazepine. Kidney function, particularly important for patients on lithium. Blood counts, checking for blood disorders associated with certain medications. Managing side effects. Managing side effects is a crucial aspect of treatment. Common strategies include dose adjustments, reducing the dose to minimize side effects. Switching medications, changing to a different drug if side effects are intolerable. Supportive treatments, using additional medications to manage side effects, e.g., anti-nausea drugs. Patient education and adherence. Educating patients about their condition and treatment is essential for improving adherence and outcomes. Key points include understanding medications, informing patients about the benefits and potential side effects of their medications. Lifestyle modifications, encouraging healthy lifestyle choices that support treatment. Recognizing symptoms, teaching patients to identify early signs of mood episodes and seek prompt treatment. Finally, we will cover case studies and real-world applications. Case studies and real-world applications. Examples of successful treatment plans. Case studies can illustrate how personalized treatment plans effectively manage bipolar disorder. Here are a few examples. Case Study 1, Managing Severe Mania. Patient profile, a 32-year-old male with bipolar I disorder, experiencing severe manic episodes. Treatment plan. Medications, lithium and olanzapine. Psychotherapy, cognitive behavioral therapy, CBT. Lifestyle changes, regular exercise and a structured daily routine. Outcome, the patient achieved significant mood stabilization, reduced frequency of manic episodes, and improved overall functioning. Case Study 2, Bipolar depression management. Patient profile: a 45-year-old female with bipolar II disorder, primarily experiencing depressive episodes. Treatment plan: medications, lamotrigine and quetiapine. Psychotherapy, interpersonal and social rhythm therapy, IPSRT. Support system: family-focused therapy to enhance support. Outcome: the patient experienced a significant reduction in depressive symptoms and improved quality of life. Challenges and solutions in treatment. Treating bipolar disorder can be challenging due to the complexity of the condition and the need for personalized treatment. Common challenges and solutions include medication non-adherence, addressed through patient education and regular follow-ups. Side effects, managed by adjusting doses or switching medications. Comorbid conditions, addressed through integrated treatment plans that consider all aspects of the patient's health. Personal stories from patients. Hearing from individuals with bipolar disorder can provide valuable insights into the real-world impact of treatment. Personal stories often highlight the importance of support, the role of family, friends, and healthcare providers in managing the condition. Overcoming stigma, challenges related to societal perceptions of mental illness. Hope and recovery, positive outcomes in the journey to stable mental health. Impact of medication on quality of life. Long-term management. Long-term management of bipolar disorder with medication significantly impacts patients' quality of life. Stabilizing mood swings helps individuals maintain better relationships, perform well in their jobs, and engage in daily activities. Improving daily functioning. Effective medication management allows patients to experience fewer disruptions in their daily lives. Improved mood stability leads to better focus, decision-making, and overall productivity. Social and emotional benefits. Medications that effectively manage bipolar symptoms can enhance social interactions and emotional well-being. Patients often report feeling more in control of their emotions and more connected to others. Conclusion. Treating bipolar disorder with medication is a complex yet essential aspect of managing the condition. The combination of mood stabilizers, antipsychotics, and sometimes antidepressants, along with non-pharmacological treatments, provides a comprehensive approach to stabilizing mood and improving quality of life. Ongoing research and personalized treatment plans continue to enhance the effectiveness of these treatments, offering hope for individuals living with bipolar disorder. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.